Hi, everyone. I'm Dr. Aaron Farberg, a board-certified dermatologist based in Dallas, Texas, with my private practice, Bare Dermatology, as well as our dermatology residency program, the Lake Granbury Medical Center, coming at you on GPP Day. Let's go. Why is it important that we have a dedicated day to generalized pustular psoriasis? Well, it's because it's so rare. It affects anywhere between 2 to 100 people per million. Normally, we see that number is a whole lot lower because these diseases are much more common. Millions of people have it. That's not the case with GPP. It's actually quite rare. But as dermatologists, we actually do see this disease. The problem is most of these patients don't always present to the dermatologist. They don't just walk into our office. They're presenting out in the emergency room, they're in the hospital, or they're going to an urgent care. And so having a dedicated day focused just on the awareness of GPP is incredibly important. It's important for the community. It's also important for our colleagues in the House of Medicine to actually hear about this disease, recognize it, and if they're unsure, at least know who to call, your dermatologist. So we have generalized pustular psoriasis, and then we have plaque psoriasis. And even though they share the word psoriasis, they are quite different. Of course, we have plaque psoriasis, psoriasis vulgaris. This is more of your chronic adaptive immunity, and you've got your well-demarcated silvery plaques on your elbows and your shins. That is your plaque psoriasis. GPP on the other side, totally different. This is hyperacute phase, innate autoinflammation, and this is a sudden, painful, widespread eruptions of sterile pustules, and they can be quite diffuse all over the body, or it could be just on certain parts, like on your trunk or on an upper extremity. There's a lot of systemic symptoms also associated with it. Imagine just being really sick. Fever, rigors, fatigue. Essentially, you're feeling pretty miserable. And of course, all your inflammatory markers are elevated as well. Now, again, where they really differ is their cytokine profile. Whereas we know psoriasis is driven primarily with the IL-17 and IL-23 pathways, we know GPP, generalized pustular psoriasis, is an IL-36 disease. In fact, there's even a mutation that when you have it can cause GPP. And that's, again, you think about all the studies we do with knockout mice and whatnot to really understand the value or importance of these different pathways. This is how we know it. And so for any of the residents out there, I can almost guarantee you there may or may not be a question on your in-service exams or your board exam related to this, because again, it's such a unique and important and very well studied now pathway. Now, one thing I will have you note is that there is a lot of interaction and crosstalk amongst all these different cytokines. I love those big pictures from the textbooks, or that our experts and luminaries in the field will always put up when they give their lectures. Here's the inflammatory soup, that we'll call it, where there's all these different pathways, but you see that they do interact. And so that's where you can see, well, there is some crossover between 23, 17, and 36. But again, it's always best to really find the primary driving cytokine to really help treat each disease specifically, as opposed to, well, it just knocks down your immune system and then it should work. Otherwise, I guess we just give steroids or cyclosporin to everyone. No. We want to find targeted treatments, and that's where we get to talk about treatments of these diseases next.